This is Meet Your Neighbor.
The following portion of Meet Your Neighbor is brought to you by Integrated Health.
Welcome back. Joining us in studio right now, we have Dr. Jason Prevost of Integrated Health. Thanks for being here.
Thanks for having me.
Of course, we're learning all about knee pain. Now, a lot of us might live with knee pain every single day. We might notice that if we're getting up or down or walking upstairs, those joints get a little bit stiff.
They get stiff, and usually that's a consequence of the knee just not bending well, with or without arthritis. You know, we found in our office that even if a knee is bone on bone, and someone is looking at surgery, very often we can help these people and get the knees bending well. Yep.
That's awesome.
It's really all about the mechanics of the knee.
Yeah, and we were talking earlier, that's kind of like what you treat is the mechanics of that knee.
Right.
You want to make sure that joint is hinging properly, essentially.
Yeah, exactly. Yeah, any hinge has to be lined up properly. It's got to have some lubrication in there, and that's basically one of the cornerstones of the treatment is to make sure that knee is operating properly. And we found even if there's arthritis in there, we can get that knee bending better.
So I feel like I know the answer to this, but when should our friends at home come see you guys if they're having knee issues?
Yeah, so like any joint, if the alignment is not just right, there's damage, and that damage accrues over time. You know, your knee's designed to last. You should get 100 years out of a knee, right? So if you're having arthritis in the knee before 100 years old, that's not normal. We think it's normal, but it's not normal. So getting that knee bending is imperative, and you really need to see about it as quickly as possible because it gets worse.
Yeah, this is definitely a pain that we don't have to live with every single day.
That's right.
And how soon, if people come in and see you for knee pain, how soon can they expect relief?
Yeah, so we've designed our knee program to where if the patient is a good candidate, we do a trial treatment on day one, first day that they see me. If we get to a point where we can do that trial treatment, they'll see a change in the knee on the same day. Same day.
That's awesome.
Yep.
That's really great. And I know we have a special offer for our friends at home. Do they need an appointment or do they need a consultation or referral?
Right, they need no referral whatsoever. It's just a phone call away. And we'll get them in and we'll examine them real thoroughly. And if we can, we'll do that trial treatment.
Nice. And on your screen right now is that special offer. So take out your phone, dial that number, book your appointment. Our first 25 callers will get a $49 consultation and exam. The address for the clinic is also right there on your screen. So be sure to dial because our first 25 callers will get this special offer. Dr. Prevost, thanks for hanging out with us today.
Thanks for having me.
Of course. If you at home want to learn more, go to our website, klfy.com. We're going to put this interview there, but be sure to call that number before we go to break.